So small intestine deciding what to absorb, what not to absorb. हम जब भी खाना खाते हैं तो पहले स्टमक में जाता है, फिर स्मॉल इंटेस्टाइन में जाता है। स्मॉल इंटेस्टाइन डिसाइड करती है कि क्या लेना है और क्या छोड़ना है, what to absorb, what not to absorb. So small intestine giving you clear perception. Okay, this is good, let's absorb. Or this is the protein, carbohydrate, fat. Oh, this is the fat, let's absorb. Oh, this is not good, okay, let it go in the form of stool. So a small intestine will give you this vision. Okay, this is good, this is bad. Small intestine हमें ये clear vision provide करता है. So this is not only physical, even this is the metaphysical. Metaphysical means हम जीवन में इतनी सारी चीजों से गुजरते हैं, हमें कब क्या निर्णय लेना है। निर्णय लेने के लिए हमें पहले क्लियर परसेप्शन चाहिए, राइट? सपोज you are having watermelon juice and rasgulla. Okay, this is sweet, this is also sweet. Now, whether I should drink this, or I should eat the watermelon, or I should eat the rasgulla. Now, the small intestine will give you clear perception. Okay, maybe this is good for me, or this is good for me. Then you will able to take the decision. Okay, this is good for me, this is not that much good for me. A small intestine will give you clarity. आपको clarity provide करता है. Whenever there are many things and you want to choose one, then you will do the comparison. Okay, this is better for me. This clear perception is given by a small intestine, right? If your small intestine is disturbed, maybe this is good for you, but you will choose this. अगर आपका स्मॉल इंटेस्टाइन गड़बड़ है, हो सकता है आपके लिए ये सही है, लेकिन आप चूज करेंगे ये. दिस इज द इफेक्ट ऑफ द स्मॉल इंटेस्टाइन. ये स्मॉल इंटेस्टाइन का इफेक्ट है. बट इफ योर स्मॉल इंटेस्टाइन इज वेरी गुड, हैविंग गुड एनर्जीज, the chi in the small intestine is good, there is no excessive heat, there is no excessive coldness in the small intestine, then whatever you are eating, you will absorb the food very properly, and whatever you are looking around, you would do the filter. Okay, this is good for me, this is not the good for me, which will help you to take the decision, जो आपको decision लेने में मदद करेगा, right? So that's why we are telling a small intestine, good small intestine means, if you are using the power of small intestine, means it's removing the cloud. Or we can understand, suppose there is a fog on the glass. Now small intestine will do like this, remove the fog from the glass. Now you can see the glass properly. Oh, now I can see reality. That is the effect of small intestine, right? So if there is an excessive heat in the small intestine, अगर small intestine में गर्मी बढ़ जाती है, तो we have already seen these all the effects coming, because the small intestine meridian passing from the area of the ear, so deafness, then chest pain, because the small intestine is having very deeper connectivity with the chest and heart, abdominal pain, tongue ulcer, SI and heart both are connected, and the nervousness, because SI and heart both are couple, and heart is, and the SI is connected with the nervousness, right? You want to perform on the stage and you're feeling nervousness, okay? And SI and UB both are together Taiyang, so there is a problem in the UB and urinary difficulty or in the genital area. तो ये सारी प्रॉब्लम हो सकती हैं जब स्मॉल इंटेस्टाइन में हीट बढ़ेगी, छाती में दर्द, पेट में दर्द, यूरिनरी ट्रबल, मुंह में छाले, nervousness और बहरापन. So we have to expel the heat. We have learned this treatment earlier. Set it the fire in the heart, set it the fire from the small intestine, turn the water point and take the loose oxy point of the small intestine. So this is the treatment of the small, this is the treatment of the excessive heat in the small intestine. Then the second pattern was pain due to excessive chi. जब ऊर्जा की अधिकता हो जाती है तो होने वाला पेन. Excessive chi will be creating the pain. This is the pattern number 2. Nowadays, too many persons suffering with this problem. Excessive chi in the small intestine. Why this is happening? Because of anger, because of revenge, because of raw food, because of irregular food habits, especially anger and revenge. जब आपके अंदर एंगर और रिवेंज होता है, लिवर ची स्टैग्नेंट हो जाती है और वो ऐसा ही ची को स्टैग्नेंट कर देती है. बिकॉज एज पर द ऑर्गन क्लॉक साइकिल वी नो द टाइमिंग ऑफ लिवर इज एंड स्मॉल इंटेस्टाइन इज 1 to 3. द टाइमिंग ऑफ लिवर इन द नाइट and the timing of small intestine during the day. Both are connected with the organ clock opposite time. So the person is having anger and the feeling of revenge. It will do the liver chi stagnation. Then it will create the small intestine chi stagnation. Then what will be the symptom? अगर liver chi का आक्रमण होता है तो person को there will be pain in the lower abdomen, there will be pain in the testicles or the genital part. And you are pressing, then pain will increase because the energy is very excessive. जब आप कहीं दबाते हो और उसे अच्छा लगे, यानी उसे डेफिशिएंसी वाली प्रॉब्लम है. If you are doing the pressure and person feel good, that is called deficient syndrome. If the by the pressure, if the person is not feeling comfortable, that is a excessive syndrome. If we are pressing here and the person is not feeling comfortable. The special thing, testicular pain. मेल के टेस्टिस में होने वाला पेन. Borborygmus, the sound is coming from the abdomen and foul smell gas passing from the flatulence, right? फ्लैटस के फॉर्म में बदबूदार गैस बाहर निकलती है, बदबूदार गैस बाहर आती है. So this is due to the excessive chi in the small intestine. Reason, who is attacking? Liver is attacking on the small intestine. So liver is having excessive chi. So small intestine is having excessive chi and creating pain in the testicle and foul smell gas. Okay. So this is the treatment. Yesterday we have already discussed. Calm down the liver chi and add few points of the small intestine. Yesterday we already have discussed this protocol. Yesterday we have discussed these two protocols. Now we have discussed excessive chi, excessive heat, and excessive chi. Now the third pattern will be when the chi is stagnant, means not flowing. जब ऊर्जा स्टैग्नेंट हो जाती है. अब हम तीसरे अगले पैटर्न की बात करेंगे. Now we are talking about the third pattern, stagnation of the chi in the small intestine. What's happening? First, we should understand this structure. पहले हमें look at here. So this is the stomach. ये हमारा stomach है. Then after the stomach is over, this is the small intestine. The first part of the small intestine. Then this is the small intestine. ये पूरा का पूरा small intestine. Actually, small intestine is having 3 parts. So all the 3 parts are here. Then small intestine is finishing here. Now after that, the large intestine is starting. This is the large intestine. So this is the junction of the small intestine and the large intestine, right? There is one structure. This is called appendix. यहाँ पर एक structure पाया जाता है जिसे हम appendix कहते हैं. So we can see in this image, this appendix is located here. At the junction where the small intestine is ending and the large intestine is starting, appendix is located here. So when the small intestine chi is stagnant, जब इसमें ऊर्जा अटक जाती है, means something is stuck here, something is stuck here. So as per the Chinese acupuncture, it creates appendicitis. Appendicitis means something is stuck in the appendix, or it is coming under the stagnation of the small intestine. Not only this, if anything is stuck here in between the small intestine, यहाँ पर कुछ भी stuck हो जाए, maybe you will see some reports and you will find something, but the most common problem, the appendicitis. The appendicitis means the stagnation of the chi, कि ऊर्जा अटक गई है कहां पर, स्मॉल इंटेस्टाइन में. That is called appendicitis. So stagnation of the chi in the small intestine is creating appendicitis. This is the appendix, and we already know appendicitis is the problem which is creating many symptoms, like sudden pain on the right side of the abdomen. पेट में एकदम से दर्द होता है, and person might start vomiting, maybe constipation or diarrhea, something, and the person might be having little fever, bloating, no appetite. The most important thing is sudden abdominal pain. कि appendicitis में एकदम पेट में दर्द होता है. As per the acupuncture, this is the, you need to treat the stagnation of the chi in the small intestine. There will be boring must sound in the abdomen. पेट में गुड़गुड़ाहट की आवाज आएगी. There will be foul smell gas. Foul smell gas is the sign of something wrong with the small intestine. And the pain in the loin area, this area is called loin. So pain is coming from abdomen to loin. आगे से पेट दर्द पीछे तक जाता है. Because SI and UV are connected, so there is any problem is happening in the small intestine, and it will affect the loin area. The most prominent problem, that is called appendicitis, right? So what is the appendicitis? Appendicitis means stagnation of the chi in small intestine. इस बात को ध्यान रखिएगा, क्योंकि लोग अक्सर इस तरह के प्रश्न ग्रुप में पूछते रहते हैं कि appendicitis का क्या ट्रीटमेंट करें. What is the meaning of appendicitis as per the TCM? It is stagnation of chi in the small intestine. It is clear to everyone? Is it clear? ये बात clear हो रही है? Okay, now we'll see the treatment. So the very special point of the appendicitis, there is a point because appendix is located on the right side. Appendix हमारे पेट में right side में होती है. So the point is also located on the right side. This is called stomach 36.5. We know this is the location of stomach 36. Here is the location of stomach 37. The length, the distance between 36 to 37 is 3 chun, and the point located in between, that is a special point of appendicitis. ये हमारी appendicitis का special point है. I will repeat once again. मैं एक बार फिर से repeat करूंगा इस बात को. So let's see the stomach meridian here. We know this is the location of the stomach 36. If we go 3 chun down, this is the location of the stomach 37, right? इन दोनों के बीच में जो गैप है, उसमें एक बिंदु पाया जाता है, the gap in between. So this is the location of the stomach 36, and this is the location of the stomach 37. In between we have one point that is called stomach 36.5. ये कहाँ होगा ये fix नहीं है. It is not fixed that this point will be here, or this point will be here, or this point will be here. This point might be little bit here and there. So we have to search the Ahasi point. Ahasi point means painful and tender point, and this point is located only on the right side. only on the right leg. That is the special point of the appendix, stomach 36.5. अगर आप चाहें तो आप stomach 36 भी लगा सकते हैं, क्योंकि stomach 36 also the distal point of abdomen. पेट का ही तो है, लेकिन stomach 36.5 is a special point for appendicitis, which is located on the right leg. Okay. इसके अलावा हम और भी कुछ पॉइंट लगा देते हैं. Like we know the lower hissy point. We are talking about the SI stagnation. हम SI stagnation की बात कर रहे हैं. So this is the small intestine meridian. We are looking the internal path of the small intestine meridian, and this is the stomach 39, which is the lower hissy point of the small intestine meridian. ये हमारे small intestine meridian का lower hissy point है. So we'll put this point also, stomach 39. Right now, remember one thing. Whenever there is any aggressive problem happening in the human body, जब भी हमारे शरीर में कोई भी aggressive problem होती है जो suddenly आ रही है, so we always treat the which meridian is very aggressive meridian. Tell me, कौन सा meridian है जो aggressive है, जिसके कारण anger आता है, जिसके कारण which meridian? Liver and gallbladder, right? Liver and gallbladder, wood element. So remember one thing, whenever there is any aggressive thing like toxic attack, then we always calm down liver and gallbladder. हम हमेशा liver gallbladder को calm down करते हैं. So what we'll do, we will calm down the liver and gallbladder. How to calm down the liver and gallbladder? We will take the grandson point of the liver, even the grandson point of the gallbladder. So this is the liver here. In the liver, we have liver 1, liver 2, liver 3, liver 4, and liver 8. Liver is the wood. This is the wood point, fire, earth, metal, and water. So this is the wood and this is the wood. So this is a self element. In the same way, we talk about the gallbladder. अगर हम gallbladder की बात करें, so gallbladder 44, gallbladder 43, gallbladder 41, 38, 34. Gallbladder is the wood, and this is the wood. Then we know this is the fire, earth, metal, and water. So whenever you want to control the acute emergency condition like the appendicitis, take the wood, calm down the wood, sedate the wood, take the grandson point, sedate the grandson point. So the grandson point of the liver will be liver 3, because this is the self point, this is the sun point, and this is the grandson point. Calm down the liver 3, sedate the liver 3. In the same way, we are coming in this gallbladder area. So gallbladder is the wood. So gallbladder 41 is the wood. This is the self point. This will be the sun, and this will be the grandson. So sedate the gallbladder 34, calm down the gallbladder 34. So because this is a very aggressive problem, so we are calming down the liver 3 and the gallbladder 34. With the help of these two sedation, we will able to handle the infection. Now, one more thing I would like to tell you, एक चीज और भी मैं आपको बताना चाहता हूँ. Let's see here. If you look at this area, we can see here. You can see this area. The liver meridian is passing from this area. So liver 3 has been considered as a distal point of this lateral abdomen also. जब हम liver 3 की बात करते हैं, तो ये हमारे lateral abdomen का distal point भी है. So this is the lateral abdomen, and liver 3 is located here. So liver 3 is the distal point of lateral abdomen, right? So in this way also, liver 3 is very good point. Now, during the appendicitis is the condition. Appendicitis एक ऐसी condition है जिसमें काफी ऊर्जा बढ़ती है, stagnant हो जाती है. So we do the CV6 sedation. हम CV6 को sedate करते हैं. Because CV6 the point located below the navel. CV6 एक point है जो नाभि के नीचे है. Right? The CV6 is the point. CV6 is the point having greater yang energy. CV6 is the point who is connected with the Ming Men chakra, connected with the fire. So we calm down the CV6 to reduce the unwanted inflammation. तो हमने इतने पॉइंट अभी तक अप्लाई किए. लेट्स सी. नंबर 1 वी हैव टेकन द स्पेशल पॉइंट ऑफ द अपेंडिक्स, that is stomach 36.5. Then we have taken the lower EC point of small intestine, that is stomach 39. Then we have taken the liver and gallbladder point, that is liver 3 and the gallbladder 34, to calm down this acute condition. Then we have taken the CV6 sedation, all points sedate, everything sedate, to reduce the inflammation. हमने इतने पॉइंट लिए. Now just we'll take 1 or 2 points and we can think the completion of the protocol. So look at here. We know this is the pelvic area where appendix is located. So the distal point will be spleen 6. Spleen 6 is the distal point of pelvic area, lower abdomen. Spleen 6 is the distal point of lower abdomen. So we'll take the spleen 6 point. हम spleen 6 point लेंगे now. So protocol will be, we will add the spleen 6 sedation here. And finally we will take 1 or 2 local point here. एक दो हम local point ले लेंगे. So we'll take the point stomach 25. Stomach 25 is the alarm point of large intestine, because appendix is located at the junction of the small and large intestine. So we have taken one alarm point of the large intestine, which is also the local point of the stomach. This much protocol is enough. इतना protocol काफी है. So I will show you here. मैं आपको यहाँ दिखाता हूँ. This much protocol will be enough, and with the help of this we can work successfully. Stomach 36.5, special point of appendix. Stomach 39, lower EC point of small intestine. Then liver 3, gallbladder 34, and the CV6, any acute infections. Spleen 6, distal point, and stomach 25, the alarm point of large intestine. इतना हमने जब apply किया, this is a very wonderful protocol to treat the stagnation of the chi in the small intestine. Small intestine में होने वाली chi की stagnation. Now remember one thing. हम जैसे हवा चारों तरफ बहती है, हवा में हम जो भी केमिकल्स हो, परफ्यूम हो, तो परफ्यूम भी चारों तरफ बह जाता है. दुर्गंध हो, दुर्गंध भी चारों तरफ बह जाती है. With the help of air, anything is flowing around. If the perfume will flow around. If the foul smelling gas will flow around. Everything will flow around. Why? Because of the air. So air is always doing the proper circulation. हवा का काम है हर चीज को circulate करना. जैसे we are sitting right now, we are exhaling carbon dioxide. But again after some time oxygen is coming to us. हम CO2 छोड़ रहे हैं, लेकिन ऑक्सीजन फिर से हमारे पास आ रही है. हमें कहीं जाने की जरूरत नहीं है, because air is doing continuous circulation around. In the same way, the human body, liver is making circulation everywhere. Liver is responsible to make the circulation everywhere. If there is a stagnation anywhere in the body, we have to see the liver. Oh, whether the liver is good or not. कहीं भी स्टैग्नेशन हो जाए, किसी भी पार्ट का स्टैग्नेशन हो जाए, हमें लिवर को देखना पड़ेगा कि भाई कहीं ये तो गड़बड़ नहीं. So that's why we are choosing in this protocol. You can see we are choosing liver 3 sedation, gallbladder 34 sedation. They will also work on the liver. So this protocol will be very worthful, very effective for treating the stagnation in the small intestine and the appendicitis. So let's see here, we are choosing the liver 3 and the gallbladder 34 sedation. If there is a liver chi stagnation, it will also work on that. ये उस पर भी काम करेगा. Is it clear to everyone?